What do abnormal Pap smear results like ASCUS mean? Imagine getting a Pap smear result and seeing the term ASCUS. It might sound confusing or even alarming, but it's actually a common finding and often not something to panic about. When a Pap smear shows ASCUS, it means the cells on your cervix look a little unusual under the microscope, but it's not clear if these changes are harmful or just benign. ASCUS stands for atypical squamous cells of undetermined significance, which is a fancy way of saying the cells look different but don't clearly indicate precancer or cancer. It's important to remember that this result is very common and usually not a sign of serious disease. Most often, ASCUS results happen because of mild inflammation, infections, or human papillomavirus infection, which is a very common virus transmitted through sexual contact. Human papillomavirus, or HPV, is linked to cervical cancer, but having an abnormal Pap smear with ASCUS doesn't mean you have cancer. It simply suggests that further testing is needed to find, what's causing the cell changes. It's a way for doctors to catch any potential problems early before they develop into more serious issues. When a Pap smear shows ASCUS, your healthcare provider will likely recommend additional tests. One common step is HPV testing, which checks if high-risk types of HPV are present. If high-risk HPV is detected, your doctor might suggest more frequent Pap smears or a procedure called colposcopy. During a colposcopy, the doctor examines your cervix closely with a special magnifying instrument and may take a small tissue sample, called a biopsy, to look for abnormal cells directly. Sometimes, your doctor will recommend repeating the Pap smear in about 6 months to see if the abnormal cells go away on their own or if they persist. The good news is that most cases of ASCUS do not lead to cervical cancer. In fact, many of these mild cell changes resolve naturally, especially if HPV is not involved. Persistent HPV infection or more significant cellular changes can sometimes develop into cervical intraepithelial neoplasia, which is a precancerous condition. That's why follow-up is so important. It helps catch any issues early and allows for treatment if necessary, preventing more serious problems later on. In summary, an abnormal Pap smear showing ASCUS means there are mildly abnormal cells on your cervix, but it's not a diagnosis of cancer. It's a sign that further testing is needed to determine the cause. Most often, these changes are caused by benign factors like infections or inflammation and tend to resolve on their own. Regular screening and follow-up tests are key parts of cervical health and cancer prevention. If you receive an ASCUS result, it's always best to discuss it with your healthcare provider, who can guide you through the next steps based on your individual situation. Remember, early detection and proper follow-up are your best tools for maintaining reproductive health.